Patients with abdominal pain present a great challenge to clinicians. Often, the cause of pain is innocent and not threatening to the patient. Sometimes, however, the cause is a serious problem that needs immediate treatment. The challenge is to correctly identify these serious causes. Determining pain is of visceral origin is a great start, but we need to be able to further pinpoint the possible causes. Therefore, a systematic evaluation of abdominal pain is extremely helpful. To do this, the clinician will try to obtain a complete history of each patient. This is important because the history usually forms the cornerstone of correctly diagnosing the cause of the symptoms. Several topics should be addressed: location of pain, character, intensity, onset, duration and progression, associated symptoms, and provoking and palliating factors. Chronic abdominal pain is defined as intermittent or continuous abdominal discomfort lasting for at least 6 months. It is important to differentiate between chronic and acute abdominal pain. The two entities have partially different causes. Acute abdominal pain usually also has to be investigated more quickly because of potential life-threatening causes, making it a medical emergency. Assessing the location of pain is especially helpful when visceral pain is referred to the surface of the body. Pain arising from the internal organs can be referred to different regions depending on the origin of the pain. For clear communication, 4 abdominal quadrants are often used to describe the location of the pain. However, it is important to realize that due to the nature of referred pain, the area in which pain is felt can be quite distant to the internal cause of the pain. The character of abdominal pain is helpful in distinguishing superficial and parietal from visceral causes. Instead of being sharp pain from visceral sources, is dull in character and more diffusely localized. Severe pain might be attributed to more severe causes as well. Be careful, however, because mild pain cannot exclude serious diseases. The onset of pain is very helpful in the diagnostic process. An acute onset of abdominal pain should promptly be investigated. Sudden events in the abdomen can cause this sudden onset of pain, and these events generally are more severe than events causing a gradual onset of pain. Vascular emergencies, such as a rupture of an aortic aneurysm or occlusion of a blood vessel, are known to cause pain with an acute onset. Perforation of hollow organs, such as the stomach, also can cause pain of acute onset. Inflammatory diseases develop over several hours or days, and corresponding clinical symptoms also present with a gradual onset of pain. Progression of pain over time is a worrisome sign because it can point towards progression of the disease. A lessening of abdominal pain, on the other hand, is favorable. Certain patterns of progression can be of diagnostic value. A colic is a form of pain which presents in a wave-like pattern. It is due to muscular contractions in hollow organs during an episode of obstruction. A renal colic is a well-known example, where a kidney stone can obstruct the ureter and cause pain during contractions of the ureter. Associated symptoms include not only abdominal symptoms, such as nausea, vomiting, and diarrhea, but also general symptoms, such as fever and flu-like symptoms. A fever can point towards a possible infectious cause of the symptoms, because the body can respond to an infection by increasing the body temperature. Provoking or palliating factors constitute anything which can worsen or improve pain. Even these factors can aid in determining the possible cause of abdominal pain. For example, coughing or stuttering movements, which increase pain, can be due to inflammation of the peritoneum. This systematic evaluation, together with information about the patient's past, such as known diseases, use of medication, and previous operations, are vital in determining the cause of abdominal pain, forming the cornerstone of the diagnostic process. The assessment of every patient with abdominal pain should start with this evaluation.